working with people affected by trauma. We've looked at the characteristics of a trauma-informed approach at a service level. In this module, we'll further explore an appropriate trauma-informed approach towards the individual. A trauma-informed approach is one driven by compassion and empathy. We need to change our mindset so we are not pathologizing our clients. Instead of asking, "What's wrong with you?" we need to change the question to, "What has happened to you?" Often people who've experienced traumatic events and unhealthy attachments will adopt coping mechanisms to survive. You can see a few examples of these on screen. We won't go into detail here, other than to consider how this might present in their behaviours. People who have adopted coping mechanisms to survive might present a range of disruptive or challenging behaviours. These behaviours influence the way our clients interact with our services and the relationships we're able to build with them. It's important to remember our clients didn't choose these experiences and have simply acquired skills and adapted as best they can to survive. If we fail to view these behaviours through the lens of trauma, clients can be labelled with conditions or disorders without understanding the underlying reasons. We can think of these behaviours as the disguises of trauma. Someone labelled as non-compliant might actually be coping with poor emotional regulation, mood outbursts, anger, depression, and anxiety. Someone who comes across as challenging or disruptive might be frightened and in a mode of fight or flight most of the time. Someone described as hostile or aggressive might have very low self-esteem, again in fight or flight mode, and find difficulty in trusting people. Someone who did not attend appointments might have a fear of relationships and doesn't feel safe or feels let down. And someone who is labelled as attention-seeking might be scared and unable to identify their own needs, with no ability to self-soothe or take care of their own emotional distress. It's important to remember we can help an individual in the way we respond to them without knowing the details of their trauma. If we need to know about their trauma, we need to avoid pushing them to talk when they're not ready, and only talk about the nature of the trauma when they feel safe, and never in a crisis. When asking about trauma, move at the client's pace, speaking reassuringly. It's important to be mindful of the impact past trauma has on individuals. Only ask about past trauma if necessary. Make it clear they do not have to answer. Be aware of their emotional state on ending the conversation, and offer some follow-up advice. It's possible to remain sensitive to the fact that past trauma may be influencing an individual's behaviour without having to ask about it. It's not just what we say to our clients, but the way we think and talk about our clients is important too. We need to challenge mindsets and our old perspectives and biases. What's wrong with you becomes, what happened to you? How did you cope? This person is weak becomes, this person is resilient. Remember, they didn't choose what happened to them. They want attention becomes, they're trying to connect and cope the best they can. They are being manipulative becomes, they are trying to get their needs met. They have poor coping methods becomes, they have survival skills. And they'll never get over it becomes, people can recover from trauma. The most basic of all human needs is the need to understand and be understood. The best way to understand people is to listen to them. Listening is the first step to effective communication. To improve your listening, focus fully on the speaker. Avoid interrupting. Show your interest, and set aside judgment and accept that the other person might have a different opinion and tolerate this. We need to be aware of not just what the person is saying, but how they are saying it. Be aware of tone, posture, body language, and other visual signals. Equally, we need to be aware of our own body language. Stay calm, providing a safe presence. Lean forward to show you're listening attentively. Find the right balance of eye contact. Too much or too little can feel inappropriate. Keep a comfortable distance between you. Many of these considerations are important, even when dealing with clients remotely. It's also important to keep communication between you positive. Set boundaries. the limits you're prepared to accept for yourself or the services you work for. Recognize the other person's distress, perspectives, and opinions as valid. Encourage communication with prompts and open-ended questions. If we're attuned to our clients' verbal and non-verbal cues, we can reflect their feelings back to them. For example, I get the sense you're quite sad today. And we can paraphrase, repeating the client's narrative back to them in our own words. It helps clients to feel they have been heard and helps us to check our own understanding. As we've seen, a trauma-informed approach understands the methods people adopt to cope and survive. This can lead them to present with certain behaviours or disguises of trauma. Once we learn to recognise these behaviours for what they are, we can start to build empathy through effective communication. In the next module, we'll look at what strategies we can use to respond to and support those people with symptoms of trauma.